morning, everybody. Welcome to another Mancoll Minute. Hope you've had a great week. So we've talked in the past about some of the myths of plastic surgery. Am I too old? Am I too young? The one I get all the time, especially with my body contouring, is do I have to be at my ideal body weight? That's a great question. And I don't tell you, in my training, I'm not going to tell you how long ago 25 years was, but at that time, when we talked about evaluating liposuction patient or tummy tuck patients, and to some degree even, breast lift patients, is you want to do this when they're at their ideal body weight and just kind of focus on isolated areas of fat, like the love handles or that little pooch in the front that people can get. But I'll be honest with you, in this day and age, the ideal body weight patient is not the average patient. And the thing that I find so amazing about what I can do as a plastic surgeon, particularly with liposuction, is, I've got patients that come in and say, I've been at the gym, 3 times a week, exercising for an hour, eating all the right things, and my weight just doesn't budge. And that's a real common problem for, particularly moms who are active and busy, and, hormones change a little bit after pregnancy and then obviously through menopause, and that weight just doesn't seem to kind of go anywhere. And they may lose, 5 or 10 pounds here or there, and on some people that's a lot, on some people it's really just, not a huge amount, and they get, they get discouraged. They look in the mirror, they put on their clothes, and they don't see the change. Well, for me, liposuction is an opportunity to change that. Pretty quickly. I can contour patients, I can take out fat in those stubborn areas. Now when they put on their dresses, they don't have those lumps in the back, their abdomen's much better. And so, yeah, there's obviously an upper limit where I say, we need to kind of get your BMI down below X, Y, or Z. But for the most part, people that are, 20, 30, sometimes even 40 pounds overweight, this contouring does amazing things for them. And when they see that change so quickly, then they get even more motivated. They start paying a little more attention to, am I really being as good with my diet as I thought I was being? Am I really working out that hard in the gym so my heart rate's up for a long enough period of time to sort of stimulate that fat burning aspect of my metabolism? And, believe it or not, most people maintain that weight. I did see someone last week who came in kind of sheepish and a little bit sort of embarrassed that she put 20 pounds on since her surgery, but she was kind of getting back into it, and she was here to sort of talk about that with me. But the majority of people really do maintain that, if not take it to another level after that, and either further enhance their results. So in my opinion, although when I was taking my boards, I would always say, sure, they need to be at their ideal weight, the real world has kind of hit me as a plastic surgeon after all these decades, and the majority of patients, really are needing and looking for that little extra motivation and a pretty quick change, and it's really amazing to see how well they do. So in my opinion, no, you don't have to be at your ideal weight. There is a range above that I think is more than appropriate to do these kind of surgeries. And for a plastic surgeon, we all kind of have our limits and our kind of line that we draw. And that's going to be as individual as the number of plastic surgeons there are. But in my opinion, you don't have to be at your ideal weight. But let's talk about it. So if you're interested and some of this makes sense to you, come in, we can have a conversation if where you are does make sense. Or if not, kind of where can we go from here? If you're not at your ideal weight, where from my perspective, what can I do to help you sort of get into a program or work with a nutritionist or a personal trainer that can sort of help get you on a track and sort of be successful? Because that's what I want for everybody, is just to be successful, whatever your goals are. So hope that was helpful. Hope you have a great weekend, and we'll talk to you next week.